Okay. I think we give it a couple of more minutes, sorry, because it's we had let me just check how many people we had registered. So
Yeah, we have Mariato joined us.
okay.
Yeah, so yeah, check how many people we
There's
have registered.
16 are registered. Yeah.
Okay. So
How
yeah,
many
so
people?
16.
16 people.
There was a bit of a clash because it's World Contraception Day, I believe. So there
yeah.
was a lot of meetings and so on going on. So
Okay. Okay, I see.
recordings were asked for.
Hi, Mariato. Thank you for joining us.
Good afternoon.
Oopsie.
Technical glitches. I first had to register, so took a bit of time, but I hope I'm not too late.
No,
Thanks.
you're not. We're just waiting on a couple more people to join us before we start. I think your voice was cutting at the beginning, but I think now it got fixed.
So
Yeah, can
we
you hear me?
didn't. Yes, that's better.
Hello?
Thank you. Yes, we can hear you.
Hello, you can hear me?
Yes.
Okay, great.
Hi, Cole. How are you?
I'm pretty fine. Thank you for asking. I'm actually walking
Great.
from meeting to meeting, and I was before this, I was in a meeting, person to person meeting, it's so nice to be. So I'm, a bit fulfilled by that. But otherwise, with so many digital meetings, I'm still struggling a bit with that. But it's fantastic to be here, to be able to meet all you people in this way, which would have been impossible otherwise. So great. Thank you very much.
Great. Thanks, Carl. I think we do have a bit of a clash today because it's World Contraception Day and we didn't actually realize. So we might have less people on the call. Sorry about that. But I think that the good thing is that we're able to record it and we'll upload the recording for everybody that's not able to join us today. Ollie, are you able to send out a reminder to people maybe?
I did this morning. I can send one quickly now, no worries.
Yeah, that would be great if you can. And then I think we can, Nihal, and then I think let's start while Ollie sends out that reminder.
Yeah, sure. Ollie, will you be able to share the slides, or Ray, you'll do it from your end? But also,
which one must I use?
Do you want to do it? I can, but I'm just writing an email.
I don't mind doing it. I can do it. Is it the one from Mariato?
No, it's the one that Ollie shared that includes both my slides and Mariato's in one.
Okay.
That means
I don't. Do I have it?
Yeah, it's a link. Let me
Okay.
send it to you. So maybe until we get the slides sorted. I saw Carl's comment on the chat. Just if people want to put in the chat the organizations that they're working at and where you based today, that would be nice to hear. So it's nice to hear that Patrick's in New York. I'm based in the UK, right outside of Cambridge. Yeah. I don't know others yet. If you want to, you can feel free to just put it on the chat, or just go off mute and introduce yourself. I see Magdalena is with us, Fortune, System.
Nihal, did you send me the email?
Yes, and Adebayo is joining us from Nairobi. Yes, I did send, no, sorry. I just sent it on the chat and it's not even.
Mm.
How do I do this? Mm.
Okay, sorry, I'm just waiting for the presentation to come through.
Sorry, my computer is giving me a hard time now.
Let me see.
I just sent it to you on the chat here.
On the chat. Oh, okay, on the chat. Okay. So the problem with on the chat is that it's not showing me the PowerPoint.
Hmm.
Do you think you could just email it to me? I don't. For some reason I don't.
Or Ollie, can you do it now? I sent it to you on Teams. Just at
Just
my
sent it to
email.
Ray. Ray, it's in your email.
Yeah, I just can't. Okay, I've got it on Teams. Let me open it. That's right. Oopsie. Share. Lord, okay, close, and then let's open in PowerPoint. Okay, I'm gonna share it now. Give me a second. Okay, there we go. Can you see?
Yes. Yeah, we can put it on slideshow. Great. So yeah, so maybe over to you, Rihanna, just for a quick introduction of the session and then yeah, we can take it off. Yeah.
Okay, great. Thank you. So hi everyone, and thank you so much for joining. And today we have some, after the last session, which was looking at the decolonization of research, today's session we're going to really be doing a bit of a deep dive into kind of what locally led programming looks like. And it's very interesting because yesterday we had a dialogue focusing on what does the INGO mean, like international NGO, so reimagining the INGO. And then today's session really is this understanding of locally led programming and what it exactly means, and how does anti-racism and decolonization feature into locally led programming. And the woman we had yesterday, also Nancy, she brought in a lot of these little nuances around why locally led programming is so important. And this is the second session for the anti-racism learning cohort. And so even if you are not here, and we are recording this and we will upload the recording as well. And I speak to people that are not here, but also people that are here. And so we really hope that we can sort of create a little bit of debate and discussion around what exactly locally led programming means to everybody and how we can feature it in our own countries, in our own regions, and talk about it a little bit more. So from my side, I'm going to now hand over to Nihal Saeed, who's going to take us through some of the, just thinking through the more nuanced approaches to locally led development. Thank you. Over to you, Nihal.
Thanks, Ray, and hi, everyone. For those of you that don't know me, so I'm Nihal Saeed, Senior Technical Advisor for Research and Partnerships. I work at the IPPF Secretariat based in London, and I'm one of the members of the Anti-Racism Working Group that is working within the Secretariat to really help us think through those ideas and themes and advance the work around anti-racism. So just for today's session, Rihanna, if you can go to the next slide. Yeah, really, our agenda today is that we want to just give a bit of an introduction to the topic, do some bit of like reflections really on what do we mean when we say locally led development. We specifically chose this session because we know that locally led and localization and those types of ambitions have been coming up a lot in the sector in relation to decolonization, and maybe this is one of the tools that we can truly speak to those values around decolonizing the sector, shifting power, and so forth. So we'll be introducing some of those themes, and then we'll have Mariato speak to us on just presenting really the case of their own local organization in South Africa around how they really imagined the locally owned and locally led sort of piece in their work, and then have more sort of reflections and sharings with us, be it looking a bit at the history of the sector as we reimagine together a different way really of doing work that is more locally led and locally owned. So if you can go to the next slide. So we want now to do with you just a Menti exercise for us, to just know really when you hear locally led and those types of terms, what comes to your mind? What do you think of? Be it in terms of elements, in terms of themes that come up. So so feel free to use the Menti. So Oli has put it on the chat. So just use that link, and I think you need to put the code that also Oli has provided on the chat, and then you just put in ideas, and I think it will be generated on the next slide, Rihanna, as people sort of start to think about terms and responses for this. So you have, there are like fields for 3 words, but feel free to put more as you want.
Can
you
this
go back?
one?
No, go back. I think it's the Menti one.
Oh, this one. Okay.
So so someone put PowerShift. I think you need to, because I see there are more words coming up, so I think you need to do a bit of Yeah, like how do you reload that page?
I don't know.
Because I see more words are coming up here. Or maybe do I just share my screen during this point until Ollie, do you have ideas how best to ensure that it's
I think just refresh the slide. If you can just hit the top and hit refresh, it hopefully will update. Because I'm seeing the update.
partnership?
Or
So
I can refresh it from here, I think. Let me try.
yeah, okay. I saw Carl's comment as well in the chat around partnership, working in partnership. And the points that I see come up here on my screen until we load the slides is that there's something around community ownership, empowerment. Someone put grassroots, someone put participatory, someone said just community, someone said power, someone wrote indigenous, needs-based, ownership, partnership. So I think like all these terms are really, and yeah, I saw as well Adebayo's comment, like all these terms are really getting to the heart of what do we mean by locally led, and what kind of elements we can think about when we say locally led and we demand in these relationships with donors, with actors around this. And yeah, Adebayo as well mentioned community leadership. So not only just looking at the community as the recipients of that relationship, service, or program, but they are leading that intervention as well. Ollie, would you be able to share back the slides, or?
I can do that. Fine.
Okay.
Let me
I'm just conscious of time because I know Mariato will have to leave right at the hour. Yeah. So just a simple definition that we put here in terms of when we say locally led development initiatives or programming, we mean that they are designed, implemented, and managed by the local communities and or organizations. So the whole objective of it is that we want to shift that decision-making power, be it from the funder or the donor, and to have that power of making decisions and taking ownership of the work with the community and those that are affected the most by the issue. And it's also within, when we use that term, we do have a recognition that the local community knows best, and they have the deeper and the best understanding of the problems that affect them the most, and as well the solutions that could contribute to addressing these problems. So yeah, so I don't know if anyone has any further reflections to share on this term when you hear it before, yeah, and we can also do a bit of a dive afterwards as well on some of the terms, be it that we see in the sector and we want to change, and some of the terms and ways of working that we want to promote more in the sector. Adebayo, please go ahead.
Yes, thanks. The terms that have been used are relevant. Community, local, voice, participation, empowerment, all those words are critical. And we cannot do development without looking at that. The issue is whether really the communities then have such powers, enablement, and capacity to be able to, and I don't want to jump the conversation, but we just need to tease out whether in real terms they are able to, whether they have the capacity, the power, the agency, the will, the commitment. The development issues we are talking about relates to their environment, whether it's in Asia, South Asia, Africa, and stuff like that. But are they actually in the decision-making environment to be able to influence? That is the question. Thanks.
Yeah, I think that is really an important sort of question for us to consider, but also not to come with the perception that the community doesn't have the capacity. It might be that the community does have the capacity, but not necessarily in the terms, of like, I don't know, funding but they do have the knowledge to contribute to the issue. They do have other resources that they can contribute. So yeah, so also as well, how we approach capacity in a way that is, that just doesn't only mean, I don't know, trained personnel with a specific methodology to do a specific area of work, and or be it resources that exist in a certain way, so that this is what we call capacity, and we discredit other types of resources that communities bring to the work. But also as well, the whole idea that when we say community-led does not mean that we're not also part of the equation, and or we don't have a responsibility towards the community. Because it doesn't really mean that we just like leave that community, okay, they know their problems, they know their solutions, so they can just do it and we take a back seat. But it's how we work with them to enable those solutions in a way that that is equitable in partnership, as someone said as well. So I think, yeah, we'll have a more chance to discuss those things, and Mariato will be able to share with us, you know, like more case specific examples on how they've done that. So yeah, yeah, thank you so much for raising that point. Hi, Kikitso, good to have you on board. So yeah, so if we can go to the next slide, Rhiannon. So I think, yeah, as we're still sort of just introducing the topic and starting to discuss some themes, so those are some of the terms that we really don't want to see popping up when we say locally led, let alone like programming in general, really. White saviorism. We don't want the old sort of ways of working within the sector where white people go into a context and think that they are just doing this life saving and they're just saving the world by doing some aid, I don't know, by having some water wells in a local village, or by just providing some medicines somewhere. That is not really development and or locally led. In research, we see a lot of this parachute research where the researchers just goes into a community, goes into a country. They don't know the culture, they don't know the language. This is their first time going there, and then they go and they claim that they're the expert on that specific topic, be it HIV, STIs, or anything really, and they collect data and then publish it and just claim that they are the experts on this topic in this community, while actually how they have collected this data was pretty extractive when working with locals on that field staff. And that is in relation when we just label the staff that is working in the country. Those are the field staff, those are the implementers, whereas those are coming in from the global north, those are like the experts, and those that have the expertise. They have the brains, and the staff in the field are the ones that have the manpower, and they just can implement and everything, which is pretty problematic, really, way of dividing those roles. Donor driven, a lot of times, yeah, we just put donor driven as an excuse, really, for not doing locally led sort of work. We say, okay, the donor is coming in with the money. We want to do this program or this intervention in that specific way, and we just don't really challenge that or question that. And this is one thing that we don't really want to see. We want to see that we working with the donor to, when it comes to like participation in the grant itself, in terms of writing the proposal, working collaboratively in writing the proposal and defining the issue and the intervention, and really having that autonomy when it comes to working with donors to really implement in a way that is locally led and owned. The other sort of term that we come up across is like adoption of universal models. We think that if a model works elsewhere, it would work everywhere. If it was proven to be successful, be it in a specific country, be it in India or something, it will work universally everywhere. And we need to be critical about what will work in what context. And when it comes to this adoption of universal models, that we need to be just do it in a way that is co-created with the community. Rihanna, we can go to the next slide. I see some comments on the chat. I don't know if anyone, yeah, Nidhi was talking about the White Saviorism book that has interesting stories. Please, Nidhi, yeah, feel free to share. Share with us with some of those things, either here on the chat, or we will have also a chance to discuss more. But yeah, thank you so much for sharing that. Yes, and then just what we want to see more of in terms of just at least the language, but hopefully as well something that is more intentional on how we do things. The community as change makers, and those with lived experience are the ones that are considered to be the experts on the issue. So those that come in from a specific community, the sex workers community, the HIV community, those are the ones with the lived experience, are the ones that are the expert on the issue, and not just the ones who studied it in a fancy college per se. Community-owned interventions, so those are the community thought about them. This is the way that they thought that is the best to address this problem and celebrate these initiatives and support the community on them. Having more sort of funder or donor allyship, working with donors as allies, and not just top-down relationships, and using some models such as participatory grant making, where we're really donors have given and enabled the community to decide on the topic and the issue, and work in partnership on the grant, and reduce those burdens, those administrative burdens that come in with receiving grants from donors. And then the last thing is really the cultural informed adaptation of interventions. So working as well with the community when it comes to those universally sort of accredited models or best practices. How do we work with the community to adapt these models in a way that speaks to the specificity of the community and what they want to see in these interventions to achieve the impact, but also staying true to be it those issues around feasibility, fidelity, and making sure that we still speak to the outcomes of the intervention, and we still reach the intervention outcomes, but do it in a way that is community owned and defined with the community. So yeah, so this is really it from my side at this point, and I'll hand over to Mariato to introduce to us more of the work that Mariato does. I'll leave you with this really just quote for now. And I know you, I don't know, Rihanna, if you want to introduce Mariato to the group. Or...
Yes, sure, I can do that. So thanks Nihal. So we, part of the learning cohort is that we also bring in external people and experts from different organizations and spaces. And we really appreciate Mariatu's time for joining us today. Mariatu comes from the Center for Community Impact, CCI, and what actually used to be called, and she will tell you a bit more about it. She's the programs director there, and what used to be called the Johns Hopkins program. And I think there was then a need for them to look at how do we engage locally, and what difference would it make to engage locally. And she's been doing this work for a while, and we asked her to please come here and talk about this work a little bit more to us, and why the need to engage more locally, and what the impact of that has been as well. So Mariatu, thank you so much, and I hand over to you. I am controlling the slides, so you can just tell me when you need me to move to the next one, if that's okay.
Is it okay if I control the slides, please?
Oh, do you want to share? Absolutely. Let me stop sharing, and then you share from your side. Absolutely, no problem.
And I hope I'm more familiar with MS Teams, so I'm hoping that this is actually a success. Right. Can you see my screen? My goodness.
Yes.
Okay.
I think you got
Center
to go to,
view.
just go up
Can
to
you see my
slide 1.
screen?
Yes, yes, I
Wait
can.
to the
If
very
you
last.
just go to slide 1, then.
Can. Okay, I am on the slide 1. You can't see slide 1?
I can see slide 1 now.
Can you see slide 1?
Yes,
Okay.
yes.
It's
But
not
it
slow to
just to let you know that from my side, I'm seeing like the slide, but then I'm also seeing the next slide. So it's sort of weirdly, unless you just
Okay.
want to do full screen.
Try again. Presenter view.
Mm,
You can still see the slides.
I'm still seeing 2 screens, 2 like.
Oof. All right. Maybe
Maybe you want to go. Maybe you want to go with just go with play from start.
Okay, let me try desktop. Can you see it now?
Yeah, yeah. Oh,
it fine?
okay. It's
Is it
still, sorry, it's still doing that. Maybe click the use slideshow.
new
So
new yeah?
go to
Use
the bottom. If you go to the bottom of the slide there, and then you click on that one. Let's see if that one works. Yeah, that one. Let's see if that one works.
though I prefer the presenter view.
But okay, all right. Okay,
All right,
that's fine. Go ahead.
Take over then. Apologies for that. Why is it not showing?
No, we see it. We're just seeing 2 slides is all. That's all.
At the same time.
It's fine, Marietta. Don't worry about it. Go ahead. Go ahead. Do it.
How about this view?
It's still the same.
It's still the same.
Yeah. Go. If you click on use slideshow, if you click on use slideshow at the top there, use slideshow.
Yeah. Okay.
Yeah. Is it
Then
working?
I don't see the slides at all.
Oh, okay, yeah. We don't see the slides either. Okay, go back. You know what? Let me do it. There it is. There it is. It's working. Now it's great.
Yeah, but I
Okay.
don't see the presenter view. It's okay. Let me see. All right. Good afternoon, colleagues. My name is Mariatu Elba. I'm the program director for HIV programs at Center for Community Impact. Previously, I was a senior technical advisor for the gender-based violence project, again at Center for Community Impact. And it's actually the experiences of the gender-based violence program that I'm going to draw from to kind of share our own lived experiences in terms of community-led gender-based violence programming. And hopefully we'll be able to connect the dots with our shared understanding of what we mean by local-led versus community-led. So like Rahana has started introducing us, Center for Community Impact was previously a Johns Hopkins Health Education South Africa outfit under the Center for Communication Programs with the, at the center, at the School of Public Health, Blomberg School of Public Health with the Johns Hopkins University. So it was crafted at that level in Washington, D.C. And there are quite a number of Center for Communication Impact satellite programs globally. And CCI or JHISA was one of them in South Africa from around 2004 up to around 2012. So then we were led from the north, the global north, and we were implementing mainly communication programs in South Africa, across South Africa, actually. However, we also got to realize in the spirit of localization, in the spirit of having a local meaning as an organization and from a governance point of view, also being able to be operational within the country where we are implementing and engaging with key stakeholders on a fair playing field, where you are not seen as an outside organization, but actually a local organization that we were, because the staffing was all local, but the governance aspects of it, there was no local registration. It was based in the United States. We realized from 2012 that we had to actually change that. And in that spirit of localization, still focusing on communication programming, we changed, we registered the organization locally within the various compliance and governance systems in South Africa. However, we still kept the name. We were still Center for Communication Impact, and we're more aligned to JHISA, for short, the Johns Hopkins Health Education South Africa, which still posed as a problem, because in certain spaces, for instance, when we're interacting with government at community level, it was always difficult to explain exactly who we were, because we couldn't, the stakeholders couldn't quite align with the organization being registered, though registered in South Africa, but being led from the global northern country. In as much as we tried in terms of programming to actually harness the challenges, facilitate needs assessments, and facilitate processes where the communities actually identify their own solutions to their own problems, it was always a sort of a barrier. And it was an even more serious barrier when it came to fundraising, because most donors would talk about, again, I think in the spirit of localization, from around the 2012s and so on, there was an increased interest in organizations that are actually locally registered and really had a board that was local, a fully fledged board that was local, and so forth. So we had to grapple with that. At the same time, we also became more comprehensive in terms of our programming, moving or shifting more from communication, social behavior change programming, where we developed campaigns, I'll talk more about them, to actually having structured interventions and programs at community level, where we not just wanted to change behavior, but change systems, support the implementation of policies and laws at the community level. So anyway, our programming changed. We diversified in terms of our thematic focus, from just HIV programming and social behavior change to also gender-based violence programming. So all that impacted on us redefining or reimagining our identity, and we renamed ourselves to Center for Community Impact, which we are now. I think we are what we are, because we also reflected and realized that the programs that we crafted really were beyond communication to changing or making a difference at community level. And so we wanted to reflect that. There was also a shift in focus around aligning more with policies in South Africa, where there is a lot of transformation going on right now in terms of human rights-based programming. And so we also wanted to incorporate that and let that show in terms of our vision, our mission, our commitment, and so forth. So CCI, just to bring it back, we are led by evidence-based programming, and by evidence, it's either desktop primary research or actually gathering insights, consultations at community level to know what those challenges are and align them with solutions that are also crafted in policies. So really looking at how we can influence policies into action or support the implementation of policies, developing strategies and interventions that transform and inspire resilient communities. So our commitment is around forging those enduring solutions, and by enduring for us, they have to be informed by what the community says are their problems and what the community says are their needs, regardless of the thematic focus. For us, it has been HIV/AIDS programming, both prevention and response, gender-based violence, some programming around advancing gender equality and women's rights and economic empowerment, basically overall health promotion at community level. So I won't dwell too much around that in terms of how we do it, providing technical support, but also direct implementation. I've just put a slide here on some of the programs that some of you might resonate with. We have a Brothers for Life program that targets men and boys, and that looks at addressing social norms and behaviors that promote HIV prevalence or risky behavior. But also we developed a Zazi Know Your Strength program for young women and girls in terms of them knowing their rights, but also their capacity to make life choices. We have currently a program on Netflix. If you go to Netflix, there is a program called Intersections, which is also around social behavior change within HIV/AIDS prevention and response. This is about 20 years old now, this program, and its content is still relevant. And here are others that we've crafted. But basically for us, I talked about our technical approach to programming is basically always first starts with needs analysis. And the needs analysis, we use best practice models to support us with gathering those needs at community level. We have used the SBCC, the P process. I'm not sure if some of you might be aware, but it's a process that actually always starts with an inquiry where you try to understand what the problems are at the community level, and then that informs prioritization of the issues, developing a strategy, and then this strategy has to be tested and validated by the very beneficiaries of the change we want to see. And then, of course, we try and implement the strategy after it has been well documented, tested, and finally designed. And then it's also mobilizing and monitoring the implementation to gather those lessons that we learn. We've also used what we call the positive deviance, what is called the positive deviance approach, which is really community facilitated problem solving to identify challenges at the community level. And this is just a process of facilitating the community to identify their own problems, but also come up with solutions that they themselves will drive in terms of implementation. So when you say positive deviant, is to identify key people within the community who are able to drive the change that the community has decided that needs to happen. They become positive deviant. So it might be something that is against the social norms. It might be something that is generally accepted, but then the community then decides, no, we need to change this because it's, for instance, violating our human rights. So we've incorporated this global best practice scientific framework in our programming to engage with champions at the community level and capacitate them. Yes, in most cases, what we have found out in our communities, the will is there, but what seems to lack is maybe how to structure that will, how to harness that energy and actually influence other people without being seen as a radical approach, but rather supporting the community champions to see it as a change that they want and as a change that is actually aligned to policies and regulation. We've also adopted reflective and collaborative learning adaptation. There's a constant process of reviewing when we implement. And this is over and above your entry level baseline that we all know we do. We do baselines, we do midpoints, we do end line kind of evaluations. I'm talking about monthly reflection sessions that are actually structured, that include the key stakeholders at the community level, where they sit back and say, that campaign that we implemented, is that exactly what we wanted to achieve? Did we achieve it the way we wanted? What could we have done differently? And that is documented, and then it influences the very next steps. And linked with that is also harnessing the strength of qualitative impact assessments, because that is where we then document lived experiences of the change that we always try to kind of champion within our programs. And I wanted us to I've heard a lot of local-led versus community-led, and I just wanted to share from our experience. It's almost easy to interchange the two, to interchange community-led and local-led, and making it almost seem like it's the same thing. But I just wanted to share from our experience, it's not entirely the same. It's a bit different. And we actually encourage the use of community-led, because for us, community actually is the community-led approach, which we prefer in our experience of programming, at least at CCI, because it emphasizes inclusiveness. It emphasizes a program that if you say you are targeting the private sector, media, various government departments, and community-led structures or community structures and influencers, then community best describes these stakeholders being a collective and working together. It harnesses that collective agency. It promotes participation and ownership. It becomes their own program and not just a USAID program brought in by Center for Community Impact. It becomes theirs. Local, on the other hand, for us, described more of a geographic location of this program. It is within a rural area in KwaZulu-Natal in South Africa. It's more location specific, and for us does not really reflect those characteristics that I mentioned under community, which is the agency, the ownership, the participation. And it may not fully capture social cohesion and collective effort. So in as much as there is an overlap in terms of geographic location, community for me, and also from just literature in the sector, better describes the collaborative, which is a huge buzzword now, especially when you talk about gender-based programming. We see it a lot in the National Strategic Plan for Gender-Based Violence and Femicide, which is our very recent blueprint in South Africa that guides all programming on gender-based violence. So I just wanted to throw that in there, but open to further discussion or opinion on the matter. But really, this is our standpoint. So even if you look back at our naming, we are Center for Community Impact. So the gender-based violence program basically was around strengthening local structures on gender-based violence response. And the goal was to reduce vulnerability to GBV. And we had 4 main objectives. Firstly, strengthening community governance and accountability, increasing primary and secondary prevention, improving the mitigation more around the tertiary prevention, but also improving access to justice. I'm mindful of time, my own time, so I'm just going to move a bit quicker. We implemented this in South Africa. I talked about, it's mainly 3 provinces. We worked with local civil society organizations in all the 3 provinces. There were 5 of them. We did have a strategic academic institution as a strategic policy and research partner, which is the University of Cape Town's Gender Health and Justice Research Unit that supported us around all the qualitative and some of the secondary research we did in the project, because that was a huge pillar in terms of our programming. This was more of our conceptual framework where we always try to identify those risks, those vulnerabilities around GBV, but we also aligned to the ecological framework, and we also had key aspects we wanted to change in terms of stakeholder strengthening local governance in terms of stakeholder engagement, the governance systems and processes itself. When you talk about referrals on GBV cases, how do you refer and how do we ensure bi-directional follow-ups and support, and also strengthening the justice system? So basically, just a second, please. Okay, when you talk about local development, I'm here now with my kids who have just joined me, hence I needed to go around 4. So I'm going to just move a bit faster and talk about, for us, the one thing that helped us to localize was to, after the research, actually use that research and facilitate sessions at community level where the community not only validated the research, and there were various ways we gathered information. We had entry dialogues, we had qualitative research, but we validated this and then facilitated sessions where they developed action plans. And these action plans prioritized what they felt should be the solutions to their own problems. They would put this on a chart, a template that we provided, and this was done with multi-sectoral stakeholders, including government, the private sector, and civil society. But also, we had what we called the Zazi and Brothers for Life clubs that also had these sessions because we wanted to harness the views of young people in these action planning sessions to also say what their views are. And this was mainly based on the finding that young men, in terms of the research, were most perpetrators of gender-based violence. So these clubs were an entry point for us to gather them in being active participants in the change that they wanted to see. So this is just a section. The forums, we had a framework developed, a mechanism for engaging stakeholders consistently. I talked about the monthly reflection sessions. They had quarterly forum meetings, but they also had within the forum what they crafted as technical working groups, because they wanted a thematic focus on these solutions, a thematic focus around social behavior change communication, which was really key for prevention of gender-based violence, but also looking at strengthening justice and strengthening the economic power or economic empowerment of women and girls that were mostly the victims of gender-based violence. And all these technical working groups also had a relationship with community-level engagements and outreach activities. So insights constantly flowed through these various platforms. And there was also accountability and trust building in the process, because when we started the program, most stakeholders had very low trust in government, especially government departments that are responsible for providing services around gender-based violence. This mechanism fostered trust and accountability because there was a constant check-in on implementation of plans, of those action plans developed, and whether or not they were being effective. Through this process, we also aligned with structured policy dialogues because we wanted to support the localization of policies at community level. So there were, of course, concept notes, thematic papers that informed dialogues. And from those dialogues, we then developed policy briefs that spoke directly to the needs identified within all those engagement platforms. And one huge achievement for us was being able to also use this information at community level to inform policy making at national parliamentary level. We had 2 key submissions during the project cycle where we supported legal submissions on the Domestic Violence Amendment Act, which was a huge policy change in South African landscape in 2021, which saw a lot of changes in terms of law and criminalizing certain practices on gender-based violence and femicide. So we made those submissions and they were actually captured verbatim, and the voices of the community reflected in the policies in verbatim. We also contributed to integrated development plans within municipalities, because this was the governance level closest to the masses. Here is just a demonstration of the process in lawmaking within the project, where we would gather the insights from the community. Though we facilitated this process with templates really led by Gender Health and Justice Research Unit, but the community had to even approve our submission to Department of Justice. So I won't get into detail, but I can come back at question time. Yes, capacity is a problem at community level, like I said earlier, and we did quite a number of trainings, also informed by the research. We used radio as a means and a tool, a means for information dissemination, but also a tool for multi-sectoral collaboration in engaging communities to prevent GBV. I think the selling point of maybe the community's success is them being able to come together. I think you can see there how they come together to actually influence decisions within the courts. And this is coming from a challenge where most of the courts were actually giving bail to perpetrators. There was very poor communication with community when they just see perpetrators who were arrested back in the community. There was very low level of communication to just update the community on what's happening, or even the families or the victims themselves. And we were able to support this process, and communities then started galvanizing themselves in terms of picketing, in terms of writing letters of demand to the magistrates to deny bail, writing victim impact statements, and they did so much on their own with just our facilitation. And in the process, because they were all working together in that group, there are CSOs, there are community members, but there are also some government departments supporting them. So there was actually strengthened collaboration. I will end with this, where a magistrate actually made reference, if you look at the third column, the last paragraph, made reference to the Masipepe program in terms of a victim impact statement we wrote in their closing statement, where they where they gave life sentence for rape. And for us, this was not about CCI, but it was really about the community being able to work together, identify their challenges, work together, and try and make a difference. And yes, statistically, we still see increase in especially femicide-related murders, but also general various sexual violation cases. But we always attest that to increase reporting because there's increased awareness. But generally in communities where we serve, there's increased awareness of rights. People know where to report and how to claim their rights from service providers. I was asked to talk briefly on how we managed USAID, us being so community-centered. And for us, we managed this through fluid communication, really, with our agreement officer, where we made it clear as a community-based organization that our legitimacy is really with the community. Yes, they are funding us, but it is not about USAID or CCI, but it's about the community. So we had that initial agreement, and from there, from that understanding, our constant communication actually then strengthened the localization agenda within USAID. So I would not even pose this. It was never an issue that we felt USAID was trying to influence, but rather they actually, they respected our approach to implementation and supported our various efforts to allow the community to lead the process. I think I'll end there. I've gone way over time. Thank you so much for this opportunity to share. Over to you, Rayana.
Thank you, Marietta, and I know you probably have to dash, but the struggles of being a mom, I see you have the
I'm
same as
sorry about
me.
that.
No, please don't apologize at all. It is part of the
Yeah.
course when you're a mom most of the time.
Yeah.
But absolutely, I appreciate these 3 points. I think they're really important for us, especially this idea of also pushing back on donors and having the confidence and the ability and the community behind you to be able to do that. So, so I think that perhaps we want to check if there's any questions from the team on the call. I know we don't have a lot of people on the call today, but if there's anything that you want to ask, please do so. And let's hear. Nihal, I don't know if you want to say anything further around
No,
that.
yeah, of course, yeah. Like, thank you so much, Marietta, to talk to us about those experiences and that great work that the CCI has led with the community. And really, I appreciate, yeah, your perspectives and thinkings about this distinction between what's locally led and what's community owned and community led. And just being deliberate and about these distinctions, and also just giving us really a case and the testament that community owned and community led works. And this is what I think a lot of times we just need reassurance, maybe that it works and it does achieve, you know, those hard to reach results that we look at, be it changes in laws and like those big system changes. They can't start with the community. It shouldn't always start from working with, be it with the government or on the government system on its own, or just work when it comes to like structuring the ecosystem and the bigger system while leaving the community behind and not really having them central to the intervention. So I think this is a really great sort of perspective that you've given us based on that experience, and a great testament, and also that the whole idea that it takes time as well. We know that community owned is not a quick and easy sort of fix to the problems. Actually needs a lot of time and investment, and to be able to achieve it at this scale and to be able to reach those results. Because also as well, our problem sometimes, be it with donors or partners, when we say, yeah, community owned or community led, they think, oh, so then this is like, we can allocate less money because you're going to just do it through the community. But actually, no, it takes a lot of resources and a lot of time to be able to achieve the results that are intended when you do it in this way. I don't know if others have any reflections to share. So I really enjoyed this. And because there's gender-based violence in there, the reports are to prove that. But the challenge sometimes would be the channel on how to report, definitely on the whole issue around reporting gender-based violence or the action that is taken, if it was reported within the restrictions of the law. So really like the emphasis on how they're working towards GBV, because it's really affected young people because of the lack of employment. And say so huge thanks to you and the FFP's perspective as well around sort of just being aware around the culture, the traditions, the specificity of that community for community-led to work, and as well just being more sort of inclusive in the way that you do that community work, be it for specific for different groups of people, be it those with disabilities or not necessarily with the highest levels of education. I don't know if you have any sort of closing perspectives to leave us on that topic. But thank you so much for the time and perspectives.
Yeah, thank you so much for having me, colleague Nihal, Rihanna, and the rest of the core, the team. I think, thanks for also picking up the time. It does take time. And it became worse during COVID when we could not engage extensively directly with the community. COVID was a huge barrier because virtual sessions were almost impossible. People will log on and you wonder if you're just talking to yourself, or whether or not they are there. And for us, what we found out was physical sessions were more interactive, definitely gave us the impact that we wanted. So technology in that case did not work for us. So when you want to work at community level, you really have to go to the community and engage with them. Virtual sessions become almost impossible, but it takes time. And I really like that you picked up that point, and it's not a one size fits all. And stakeholders are at different levels, different stakeholders are at different levels. So patience becomes key. So I wish us all the best as we continue with this work, and thank you so much for this opportunity. Looking forward to the recording so that I listen to the rest of this. Unfortunately, I need to take the kids home. Okay,
Thanks,
then.
Mariatu.
Thanks a lot,
and you as well.
Mariatu. All the
Yes,
best.
thanks.
really
Bye.
appreciate your time.
Sure.
Thank you. Yeah, so just to say, you know, that it's very interesting that I think the time aspect is an important one, is that when we have meetings or consultations or thinking about time, doesn't always fit with everybody, you know? And I think that we've tried, and I struggle with this a lot actually, because I have to do lots of cross-federation, cross-secretariat meetings. And my privilege is that I sit in this middle time zone, right? Europe, Middle East, what's it?
Africa.
Europe, Middle
Yeah.
East, Africa. I sit in that time zone. So I don't actually have to worry about, you know, my morning or my evening. Am I joining calls? But when I look at like colleagues that are joining, let's say from the Pacific, or let's say from the Caribbean, or from Australia, or from, you know, South Asia or East Asia, we have to then, we swing that sort of that pendulum to accommodate people, and we try and say, okay, well, you know, I'm going to get up early and I'm going to do this call early in the morning, and but it needs for us to also recognize that that is a privilege and that is a difference of where we sit in the world. And so for this understanding of kind of locally led, if we're working from an international perspective, but working with local organizations, we still need to also understand that local perspective and time-wise. So I make that point very deliberately also. I wanted to say that I've uploaded another. I think I've uploaded another book, and Ollie, I don't know if it's there. It's called The INGO Problem, and it's also on the MA Forum. Maybe Ollie can check if the book is there. If it's not there, I will upload it. But it speaks a lot to this sort of privilege that also comes, and I talk about privilege that also comes from when you work for an INGO, you know, rather than when you work for a local organization. Because what happens is there's a disconnect, and there's a kind of like people who sometimes work for INGOs also come in with this kind of like, oh, well, we're the experts, we know better, we can, you know, we're coming in to sort of tell you that. And sometimes when you work for a national NGO or even a community-based NGO, you don't always feel that you can challenge that, like that level of confidence is not always there. And so the understanding of being able to, one, challenge the donor, challenge the, you know, I mean, IPPF it's a bit murky. Are we a donor? Are we a partner? Are we a, you know, what are we? I heard this the other day. And so like even just saying, well, no, I don't agree with that. Like, can we do it this way? Or, you know, these regulations are too stringent and they don't apply to me. So like, how does one come in from a locally based organization and be able to sort of challenge those perceptions and those ways of being? Because the system in itself, sometimes you feel doesn't allow for that to happen. So yeah, so that's quite interesting. I don't know if there are perspectives of that from different from people on the call that maybe want to speak to it as well.
I did have a couple of slides as well that we can also, yeah, like, but more than welcome if people want to share more perspectives on this, but also as well a set of other questions in case people want to reflect on. I can share, how do I do that? Yeah. So I can share the just the remaining.
Thanks, Nihal.
Yeah, in case that's also helpful in as we sort of situate our thinking on the topic. But let me check. There is a comment. Oh yeah, Ollie shared that book that Ryan was referring to. So yeah, so also more reflection questions, and it's about, some of it is about sort of recognizing that like the development sector, and this is something that maybe we want to discuss more, the whole idea that the development sector was sort of a byproduct of colonialism. And I'll show you some bit of timeline that was done for a previous paper that tries to situate that whole idea that the development sector did not just exist in a void, but we are a byproduct of a way of working that was extractive and colonial, and there were a lot of power. And I think maybe as well alluding to that question that Rihanna was referring to, is like, because yeah, like a lot of those are on the call are from member associations, and those are local organizations. So it would be good to get your perspective. How do you perceive the work of the international actors in the communities, and how is it being perceived by the community? A lot of times those whole issues around how are we perceived within the community, that whole positionality aspect. We spoke about it last time in relation to research, but also we want to speak about it this time in relation to interventions and programming, because the argument is still there. When we do a specific work in a community, it is important to recognize our own positionality to this community, and how this whole positionality and that power in the relationships and these dynamics do affect how we are being perceived by the community, but also the outcome of this work. Also, the whole idea around local knowledge, is local knowledge being appreciated in our work? We spoke about it last time as well in relation to research, but also it's still valid when it comes to interventions and programming and service delivery. As well, those whole metrics around monitoring and evaluation. A lot of times monitoring and evaluation is being just viewed as this is a compliance issue to the donor. So we need to provide these reports with the M&E indicators, because this is what we have promised the donor, and this is what we need to reach. Otherwise, we're not going to receive more money from that donor. But it's not being looked at in terms of, are these indicators really speaking to the local priorities, or they're speaking to the donor priorities, and what the indicator, what indicators the donors want to see reported on from this work, as well as the whole evaluation process. As well, if we were to do evaluations, be it post-program evaluations for our interventions, who defines really the outcomes that the evaluation tries to measure? Does the community get to define it, or that is, be it the staff that sit in headquarters, or the donor? So yeah, so I'll stop here if anyone has any sort of reflections or thoughts to share about any of those issues. Or yeah, feel free to either unmute or just add on the chat. If anyone has any thoughts, Itzo or Carl or Fatki or Adebayo. Colleen. I know it's at the end of the day for some of you, so don't want to be pressing too much. Okay. So I think I'll move on to then the next slide, and yeah, feel free to stop me at any time sharing reflections, and that is speaking to that point that when we talk about those issues, it is important, and this is also speaks to some of the themes that we discussed last time. The whole concept of decolonizing is very much, is sort of trying to undo the harm that colonialism did. But it's also to recognize that the harm that colonialism, and Carl, if you want to go in first before I go on that point, please do.
Okay, thank you. No, but I just, I thought about a short reflection on how my reactions to what we've been talking about now today, from an RFSU perspective. We work together with the local partners in many different countries since many years back, supported by the Swedish aid agency. Also since many years, we kind of a prioritized partner with them. But I know also that we have worked a lot with, I think, this kind of concept with community-led partnerships together with the partners. And our international unit also recently presented a research study where they looked at different kind of organizations of our kind in our part of the world and how they were perceived by the communities and organizations locally that we worked with. And we really got really good results there. And that's why I thought it was so interesting to listen to this, and that it should be more people from us, actually, from our international unit listening to it, because they would be able to go deeper. But I know that we work very much with this kind of, we try to get better all the time, and we try to work much more, I think anyway, without having the expert knowledge, in a community-led way of working. So it's so great just to realize at this meeting and at many other meetings too, together with IPPF now, that there is so much that we, regardless of where we are, actually, we try to do better in the same way. And of course, we are in different places from the beginning, but I'm confident that I will take this to my organization also, and talk more about it there, and tell them and about what we have talked about today. So really interesting for me and for RFSU. Thank you very much.
Great to hear, Carl. Thank you so much, and please share that research. I would love, I'd love to read it, because it's very interesting.
I will look into it and share it.
Perfect. Thank you so much. Adebayo?
Yes, thanks very much for these reflection questions. I'm looking at them, and I find them very fascinating. I know you will still be talking about the development trajectory, the history, and the timeline, starting from eugenics and stuff like that. For those of us who worked in the area of HIV and in vaccines, there has always been perceptions, anti-vax controversy, that some of the issues and interventions that are being implemented within the development space actually have some colonial perspective. Even when we talk about being in a post-colonial state, many people in the communities also still talk about. We saw that with COVID vaccine. I worked in UNICEF. We saw that with many of the vaccine, BTG, and all those kinds of vaccines. So I don't know whether that will ever go away. That is number one. Number two has to do with the conception of local knowledge. If some people think that the characterization of knowledge at the local level, by calling it local knowledge, is actually discrimination. Because what is why do you call it local? knowledge is knowledge, Yes, because if where it is coming from, you describe it as local. So are you calling knowledge from the other place international, sophisticated, and stuff like that? So this is an area where there's so much polemics and controversy. And one of the papers I had done before, many years ago, is the whole issue of controversy around public health interventions. We'll always have controversies around data. We'll always have controversies around vaccines. We'll always have controversies even about funding. And the whole issue of development framework too, we'll always have controversies around it. I think at some point we should just be a little realistic about what we can change and what we can't change, and to be. I'm not against effective change across the spectrum, but the construction of the international political economic system leads to inequity that we are either indirectly addressing through localization agenda, decolonization agenda, and stuff like that. I think I'll just
I totally agree with you, Adebayo, and yeah, very, very interesting perspective about local knowledge and why do we name it as that? It's just knowledge really at the end of the day and needs to be appreciated as such, and not just viewed as something exotic, which we can talk more about. So speaking of timelines, but that is not just an exclusive, I wouldn't say that. It's just a set of events. And so you see like colonialism went hand in hand with eugenics, which is sort of what is expected, that whole idea around ableist and racist sort of ideology, and that is really at the heart of the reproductive health sort of history. That is something that we need to reckon with. And then onto that, going into the 1920s with the criminalization work that started, be it with sex work, with abortion, that still continued to happen. The Tuskegee experiments, quite horrific, really, practices when it comes to black bodies and just enrolling them in clinical trials and not giving them the medicines and leaving them to die, really. Onto coercive sterilization, and that is a practice that we know that still happens. Maybe it's not as a blanket, be it against specific populations as it used to be in some countries, but also we know that still happens, be it specific against specific groups, migrant groups, or groups of a certain marginalization. Sort of the apartheid regime as well in South Africa, and how family planning was also instrumentalized as a tool as well to address population growth for the Black population. Going on to the 1940s with the Mexico City policy that is ironically still very much affecting the sector up until now and onto the future. Those are the projections. We know that didn't really only start in the 1990s, but the evidence became more and more that the SRHR sort of outcomes are the worst amongst the Black and women, be it in Africa or other countries in the global majority world. And it's that triple whammy of oppression. That oppression is really at the heart of these health outcomes. The denialism of HIV. Now we see the denialism around Mpox, around other types of diseases, and how those are really stigmatized. The global gag rule and how that has impacted abortion in the States and internationally. Onto now the legal systems that are being used and weaponized against the LGBTQI sort of populations. And there are those like yellow circles, that is the collective sort of work that is happening, be it at the UN level, the recognition around human rights, the formal decolonization, the CEDAW, the Convention around ending all forms of violence against women, structural interventions on funding the SDGs agenda. But as you can see in the timeline, the NT's forces are too much really for us to address, and they're just overwhelming the sector. And this is something that we need to recognize really when we do our work. That whole baggage of our work does really impact how we deliver, and on top of that, we don't really deliver it in a way that gives the community the justice and ownership that they deserve, that even adds to more harm, I would say. So yeah, Carl, thank you so much for sharing that article. Yeah, I look forward to reading it. And then I'll just leave you with even more reflection questions. And hopefully we can still continue taking this conversation on the MA forum, in terms of, if we were to adopt, be it a definition of around locally led, community led, what can this look like, and what kind of perspectives and models that we can use, and what elements you want to see more within IPPF. And hopefully, it would be great if you could bring examples from your work, what you've seen actually has worked from your own experience, and those whole topics around how we position ourselves in the work and navigate those dynamics. Yeah, Charles, ensure that evaluation is aligned with the needs and the priority of the community served. So yeah, Charles here is sharing around the evaluation issue and ensuring that it speaks to the priorities of the community, so that we can assess the progress and share as well the findings. So that's really good practice, Charles, and thank you for sharing that perspective. So yeah, so that's it really from my side, and I'll end up on this note. And feel free to share any remarks from your side, either now or just take it on to the MA forum. And Rayana, thank you so much for everything that you've done. I don't know if colleagues know here that you're sadly leaving us, or maybe you want to break that news quickly before we finish.
Yeah, so thanks everyone. This is it's my last week at IPPF this week. Yes, and I am sadly moving on. I'm just going to take a bit of a break, but I am still going to be, helping out here and there on the cohort. So with Ollie, I will reach out, and so we have the 2 more sessions left. For the next one will be done by the Asia Safe Abortion Program, and they work around understanding decolonized approaches to reproductive health, reproductive justice, and also abortion. So that will be the next one, and they've prepared a great session for everyone. And then the last one actually will be Prof. Adebayo, who's on this call, and Prof will work together with Shireen Alfaki, who's the Alfeki, sorry, who is the head of narrative and training, narrative and voice for IPPF. Yes, so that will be the last session for this cohort, and hopefully we'll be able to take this forward as well with everybody else. But I'm putting my Gmail into the email, into the chat, for everybody, and if anybody wants to reach out to me on Gmail, you're very welcome to do so. I'm also on LinkedIn. And yeah, I'm still gonna be on the SRHR streets, but I am going to be taking a bit of a break after IPPF. Yeah. And Carl, just to say that let me reach out to Ingela. I'm very happy to have a call with her before we do that dialogue in October the 30th. Was it November the 30th? I'm going to ask Ollie to send, I'm sorry, I have a colleague called Jamila, and I'm going to ask Jamila to send all the details, and we can then set up a call as well. Okay.
Great.
Thanks, everyone. I don't want to take up too much of your time. I know that everybody's time is precious. And Fethi, enjoy New York and have fun. And I will connect with you separately as well, and with everyone else. Okay. Take care, everyone.
Thank you. So sad not to see you anymore, Yana.
Oh, thanks, Carl.
Really?
Yeah. No, yeah. I will absolutely still sort of be hanging around, but not online. And happy to sort of chat if anybody needs any support on anything as well. Okay.
Yeah, will you communicate your new contact details and so on?
Yeah, I've just put my Gmail in the email so you can see it's there.
Yeah.
Let me do it. Yeah. And then if you wanna email me, very happy to take emails as well.
Thank you and good luck, Rihanna.
Thank you, Carl. All right. Thanks everyone. Take care.
Thanks,
Bye.
everyone. Take care.
Good luck,
See you
Aracel.
next call.
Good luck.
Bye.
Bye-bye. Bye-bye.
Bye
Bye.
bye. Thank you. Take care. Bye.
Bye.